Good afternoon to all. Welcome to the second day of our kickoff meeting of the BeEmTel project. Today we will have a 2.5 hours of intensive work about telemedicine and telecare, following what we already discussed yesterday. And the first speaker is a speaker of the University of the Eastern Piedmont, Marco Invernizzi, who will discuss together all of us about telemedicine today, the new frontier of intervention. Marco, up to you.
Thank you very much, Gianluca, for this kind invitation, and welcome everybody. I will start. 1 minute. Okay. So, as Professor Aimaretti said, I'm an associate professor in physical and rehabilitation medicine at the University of Eastern Piedmont, and my main research areas are the rehabilitative interventions in frail subjects with specific recent interest in Tele Rehabilitation approaches. So before getting to the heart of my presentation, I would like to make some premises. These are some data, very recent data of the World Health Organization. We know that in the next 30 years, we will observe a demographic shift. The world's population over 60 years will nearly double from 12% to 22%. And in 2050, 80% of older people will be living in low and middle income countries. So the pace of the population aging is much faster than in the past, and all the countries will face major challenges in terms of these issues. So to face these issues, we need to implement cost-effective and sustainable interventions. And in this scenario, for example, healthcare and safety monitoring for the elderly is becoming an urgent issue that needs to be addressed. So we talk about all the wearable computing and remote monitoring system that can help these patients with these issues. So some historical notes and definitions, but I am sure that yesterday they have been provided by previous speakers. With the definition of telehealth is electronic and telecommunication technologies and services used to provide care and services to patients without physical contact. So with these devices, we overcome the geographical limitation between patients and physicians. Telehealth is a broader term that incorporates telemedicine and includes indirect benefits like health indices, preventive support, and this is a goal of this project, medical education. They are something not so new because telehealth services have been available for the past 20-30 years, but the use has expanded rapidly during the recent pandemic. Regarding telemedicine, the definition is the usage of any electronic technology, including audio, video, and real-time interactive communications that facilitate the administration of healthcare to patients who are geographically separated from providers. So telemedicine is something smaller and more specific compared to the concept of telehealth. It's not a new concept, and it will likely move into the post-COVID pandemic era, where it has spread with a rapid use in several fields of medicine. But today, the new target of telemedicine is to integrate in its processes different technological areas. We all know what is artificial intelligence, machine learning, and data analysis. I mean, obviously, big data analysis. So a recent effort is to integrate, for example, advanced data analysis and machine learning approaches into sensors or embedded system applied to healthcare and healthcare providers. And another cornerstone of the digital innovation in the field of health and of telemedicine is, of course, the implementation of the cloud computing support. Cloud computing provides pre-existing and configurable internet resources, such as archiving, processing, or transmission of data available on demand through the internet. And this technology has gained significant attention to enable remote patient monitoring, for example, and it helps to reduce the cost by the efficient allocation of medical resources, such as equipment or personnel. So it has a strong impact on the sustainability. But we have, after all these pros, some cons. Storing, assessing, and sharing the patient medical information on the cloud need a particular attention to security. And a practical example of a large-scale cloud computing project is the Gaia-X project, which is an European project to create a federated and secure data infrastructure. So companies and citizens will collect and share data, but they should decide what happens to their data, where they are stored, and always retain data sovereignty. And the implementation of this project aims to create an independence of Europe from other technologies, mainly from the United States and the Asian countries, and create common standards for European cloud operators to control the transparency of infrastructures and create an interoperability of data between the various operators. And the final goal is to create an independent European cloud. And in this scenario, we all know what is the Piano Nazionale di Ripresa and Resilienza, is a sort of restart plan after the pandemic, which is shared by three ministries, Italian ministry, the economy, the innovation, and the university ministry. And the key point of this project is the Italy participation in the Gaia-X project. And I'm sorry that this is my only slide in Italian, but I think it is quite clear. Speaking of this great restart project in Italy, we see the weight in numerical terms of the various interventions and goals that apply to digital innovation in healthcare in Italy. 0 is a not relevant objective, while 5 is a crucial objective. As you see, the first goal of digital transformation in Italy is the implementation of telemedicine solution. And is followed by sanitary software and document digitalization and the implementation of digital territorial services and intelligent artificial intelligence applied to the healthcare system. But what are, to date, the data in literature about the implementation of telemedicine interventions during the pandemic? In this recent paper published in JAMA, the author assessed in a cohort study the trends in the use of telemedicine and outpatient visits in 2020 among a sample of more than 16 million patients those related to the Medicare insurance or other insurance system in the United States. As you see, the rate of telemedicine visits increased rapidly during the first phase of the pandemic, but declined by June. So when the first hard phase of the pandemic started to decline. We had a dramatic increase of the telemedicine visits, as you see here, and a significant decrease of the in-person visits. But these data are clearly showed in this graph, where we can see that the telemedicine used during the early pandemic only partially offset a drop in the total outpatient care. And we see the decline previously described in the late June, so when the restrictions related to the pandemic were slowly coming back. So it seems that there are some issues, practical issues in the implementation of telemedicine interventions. And this paper, with somehow a provocative title, tried to answer to some of these practical issues. So the authors stated, what are the main barriers to the uptake and continuous use of telemedicine application from the patient perspective? And the results are somehow interesting because despite the strong evidence and also the wide range of different applications in the telemedicine field, most of all fail to be implemented in the common clinical practice. Most of them because they have a high dropout rate, so there is a strong discontinuation over time. And most users have some of, as we can call it, technology gap. So a sort of difficult use of these devices, and sometimes also a poor usability of these devices applied in the common clinical practice. And another crucial point that can somehow limit the implementation of telemedicine intervention in the common clinical practice are the so-called ethical issues, because we know that there are some critical points like the risk for privacy and confidentiality, the limitations of interaction, mostly from the physical point of view, and the potential for disruption of the well-known and crucial relationship between the patient and the physician. So all these points are crucial for the implementation of these interventions, and they should be addressed in the immediate future. What about another intriguing aspect related to telemedicine? And this is somehow my field of interest and also my field of expertise. We are talking about Tele Rehabilitation. We all know that in the context of the pandemic, new strategies to provide rehabilitation intervention and physical therapy have been proposed. And in this particular field, we have several evidences of a positive impact of telerehabilitation intervention in several fields of rehabilitation, like, for example, the musculoskeletal area, the neurorehabilitation area, the cardiac and pulmonary rehabilitation area, in terms of both functional improvement and health-related quality of life improvement. All these intervention, and here we have a recent meta-analysis, very well conducted by the authors, published in Physical Therapy. All these interventions offer positive clinical results, as I said before, in terms of both health-related quality of life and functional outcome. And they have been compared to conventional face-to-face rehabilitation approaches with extremely positive results. The pros are obviously the lower cost and the less interference in patients' daily life of the rehabilitation process. However, sometimes it is complex to implement this intervention in common clinical practice, and we also need a sort of paradigm shift also by the health professionals involved in the rehabilitation process. Another extremely intriguing field in the telerehabilitation area is the implementation of this intervention in the cancer rehabilitation field. And this is another field where I spend most of my scientific and research efforts in my also clinical efforts in my daily practice. My last slide is something which fits, in my opinion, in a crucial way with the purpose of the BeEmTel project, which is the crucial aspect of the teaching implementation of telemedicine. And in my opinion, university have a crucial role in this aspect. My questions are somehow a stimulus for the audience. In particular, what about implementing specific telehealth and telemedicine modules in health professional degrees? And what about to implement new digital strategies for teaching in the health field? And what about to implement also new teaching strategies and specific teaching modules for other professionals involved in the health field? So I think that these questions are somehow a stimulus for the audience and address some of the ideas at the base of the BeEmTel project. So, in conclusion of my talk, here are several pros and cons about the implementation of telemedicine solution in the common clinical practice. And I think that our goal and the goal of all the clinicians and non-clinicians involved in this process will be to address these issues, so to focus on the right part of this slide in order to boost the digital innovation in the health field and promote in common clinical practice the implementation of telemedicine solution. Thank you very much of the kind invitation and for your attention.
Thanks. Many thanks, Professor Invernizzi, for your very interesting talk. Yesterday we discussed about the teaching pedagogical methodology that you use telemedicine means, just like telesimulation. So it's very interesting that from you that you will be used as a teacher for our e-course in a particular module that will organize through the first phase and the second phase of our project. So we have time, but you will be a teacher. So I would like to say to audience, and there will be modalities, ways, and teams to develop within our course. But yesterday, yes, we focused about the one of the topic that you talk about, the methodology in which telemedicine can be used for teaching in nursing or in medicine. So this is a very important point for us. And also another important point will be your topic, your main interest about telemedicine. So we have today some very expertise about this topic. In fact, I would like to give the floor to the director of the Italian National Center of Telemedicine, Professor Francesco Gabriele, from Istituto Superiore di Sanità. He can talk about the development of telemedicine here in Italy, and in the last years, or maybe in the last month, through the due to the pandemic crisis. Please, Professor Gabriele. I don't know if you...
Let me thank you. Let me few seconds, because my computer here is a low connection.
We can see you. We can see you perfectly now.
Okay, thank you. I'll try to. I try to share my slides. Oh, let me know if you can see my slide now.
Yes, now we can see. So, but share the entire screen.
Yes. Yes, I'm going to do it.
It's a suggestion.
Okay, perfect.
Can you see it?
Yes.
Yeah. Perfectly.
All right. Thank you for the invitation to this kickoff meeting of this project. I'm very happy and proud to be a part of this project. Because of the, I really think that it's very strategic, significant for the improvement of telemedicine use in European areas. If we succeed in developing new and more adequate techniques to train new physicians or healthcare professionals more in general to work better, to be able to work better in the telemedicine field, and more to be more adequate to not only to work on it, but also to design new services and to project them. Because of not only because of the technologies, the information and communication technologies are very very quickly evolved in other solutions, in other possibilities, but also because we need to organize, reorganize the healthcare services in order to reach the best, the optimizations of the usage of technologies. I hardly think that e-health in general, telemedicine in special, is not a technological evolution of the medicine. Instead, it is an evolution of medicine using technologies. It seems a joke of words, but it's not. In this joke of words, there is an important message in order to obtain the best results for the improvement of new healthcare systems in Europe, and especially in Italy, that is we have a public healthcare systems at national level, even if some responsibilities are delegated to the regional administrations. And we are working hard in this period, also cause of the new plan for the public investment that Professor Ivanizi cited in his presentation, and but also because we have to reallocate the resources, the human resources and the material resources in our services. We understand, not only we understand, we experiment in first for the first time in the whole Italian territory. This needs to re-engineerization of our work processes in healthcare, in territorial healthcare services. Let me tell you something about in our first meeting. Something about the National Center for Telemedicine, and the extended, the complete name is for Telemedicine and New Healthcare Technologies, is the official name. Is a national center, one of the national centers of the Istituto Superiore di Sanità, that is the Italian National Institute of Health. And you can find all the information in our website that you can, the address, the URL, you can read the URL at the above of this slide, And more or less in this slide, I try to summarize the strategy and the path for development of the National Center, where the National Center was established in June in 2017, and our mission is to lead, promote, and coordinate research and the governance of the system for for the social and the healthcare applications of the new digital technologies and the telemedicine. This is my mission that you can read in the institutional national rule that established the National Center. And so we try to work in order to reach our goals with this pathway that you can read in 3 steps at the center of the slide. Support. At first, we work supporting the local development projects, acting more or less as a consultant on telemedicine projects, not only to verify the projects, the local project, but also to implement, to design, to support the implementation of new services. The second step is the defining of national pillars on cybersecurity at first, just to defense the healthcare data and the security strategies for the healthcare organizations in Italy. Studies on reference legislation, and in order to harmonize them. The economic evaluation method. You know, in the international literature, you can find an amount of different system in evaluation method, in economic evaluation method of telemedicine services, but the majority of them was based on different healthcare systems. Mainly private healthcare systems, and so is not really adaptable to the Italian situations, because we have the majority of services, care services in Italy are public. And so we have to try to reach our method, our economic evaluation method for Italy. And on the base of this method, to elaborate the right fee for the reimbursement of the professional activities in telemedicine. And another pillar is the medical guidelines. We work a lot. I will show you in the next show this. In order to elaborate the effectiveness for the Italian services in telemedicine, and these guidelines are at the same time the base to train new professionals, to organize better services, and at the same to develop new clinical trials, a new method for clinical trials. And at the end, the third step is the development of a professional community on this subject, of telemedicine subject, of e-health, more in general, publishing with publication, with publication, training courses, conference, and so on. The strategical goal in short is reach the Italian mode for telemedicine and apply it to the reality of everyday in healthcare services in Italy. We also start to organize and to propose the Italian model for telemedicine, and promoting it at the national level, in not only for the cooperation in developing country, but also as in collaboration with the research and development projects worldwide. For this reason, starting from 2020, even if the limitations of the pandemic period of the pandemic period, we became institutional member of the International Society for Telemedicine and E-Health, and member of Digital Health Advisory Group for Europe. And in this, we started a collaboration with countries in Latin America, collaborated with Ecuador at first, then Republic of Panama and Brazil, in the development of a new system for telemedicine in a rural area in the Brazil. And at the European level, we proposed the so-called Charter of Trieste, because we presented it at first time as of 2020 in Trieste. The Charter of Trieste is a proposal accepted by the Digital Health Advisory Group for Europe, proposed by the National Center for Telemedicine and in the Istituto Superiore di Sanità as a whole, collaborating with other organizations, public and private no-profit organizations. And the charter is dedicated, it's focused on the accessibility to services for all persons, services in the meaning of digital services, not only healthcare services, but also, for example, smart living solutions or assisted living for home care and something like that. There is an issue concerning on this at not only at European level, but also at global level, because of the often the technological solutions and the services are based on the utilization of applications or software or hardware based the usability for normal people, and not for people that have disabilities or that experiment some limitations in their capability to interact with softwares and devices. Let me underline our public publications that we performed during the first period of COVID-19 pandemic period in Italy to support healthcare, territorial healthcare activity in telemedicine during this difficult period. We propose, and in many regions, in many areas in Italy, this model, this scheme was really applied during the pandemic, reaching to support professionals, physicians, and their patients in deliver services, healthcare services, even if they can meet each other physically. And we design it in different situations, in different solutions, and we arrive to describe the three different situations in which we propose a different mode of operative modes, or for standardized and not standardized in base of the different patient needs. It means also an organization scheme in the sort of back office of these services, and we design and explain how to reach them with few resources, few economical resources, also with a few persons, few professionals. From this experience and starting from the study we performed in the years before of the 2020, we were able to support from a technological point of view, from a scientific point of view, the approving of the at the national level of the national guidelines for the provision of telemedicine services in 2020, at the end of 2020. And at the end of 2021, the national guidelines for the provision of Tele Rehabilitation services by health professionals in Italy. Unfortunately, these two documents are all in Italian. We are asked the authorization to translate in English as soon as possible, but it's not so easy for us in this moment, because we have an amount of activities to face the pandemic at the time from the national authorities. And one of these activities is to elaborate these documents, this consensus document, national consensus document, on telemedicine services, on tele rehabilitation, on telecare, and then the document on cardiovascular and pulmonary rehabilitation and telemonitoring. We are working on that. We are close to hand this part. We scheduled another group focused on Telecertification during 2022, but this is not started in this moment, because it's very difficult to do it, because this legislation in Italy concerning all the certification performed by physicians was published in before the internet era. So they did not think the possibility that someone certified somewhere without being in the same room of the patient. So we have to change also an amount of laws in Italy to reach to the way. And this is the difficulty of course of this part of this phase. Also, we start working with other scientific societies in Italy to elaborate all the other consensus documents in telenephrology, telepediatry, hospital telepharmacy, telepathology, teleoncology, teledermatology, and so on. We are working also in this field, in the development of new system for open access model for patient data sharing, and in order to innovate the clinical trial using telemedicine system, using a digital system to work to organize a research collaborative network to make possible a new way to for decentralized clinical trials, using a new approach based on the use of the extensive use of digital researches. This is more or less what we we work in this moment in Italy. I really thank you for the attention. Let me, in the next meetings, we will work, we will discuss with you and share with you all the strategies that we want to, we desire to develop in this project. More or less, we started from all these experiences that I will try to summarize in these slides. In order to organize the adequate system to not only to train new professionals, based in a certain sense also on simulations and virtual reality, but the virtualizations of actions have to be evaluated in order to understand the best pathway to reach an appropriate training for young people at first, and also for professionals not so young that are working in this moment in our system.
Many thanks, Professor
I think
Gabriele.
that we can stop here. We can stop here, and thank you again for this occasion. We will have other occasion to discuss in deep this last phase, this last point of my speech. Okay, thank you so much.
Thanks, many thanks, Professor Gabriele. And I would like to remember our partners and to the audience that these are the topics that we are going to discuss on April, because on April we have to start the second phase of the project, the organization of the entire e-course, led by your institution, Professor Gabriele. So we will discuss deeply these topics in particular, and we are very proud. It's an honor to host the National Center of Telemedicine and New Healthcare Technology as partners. We know that Istituto Superiore di Sanità, the Italian National Institute of Health, has many participations in European projects, but we know that your institution is the first time that cooperate in Erasmus Plus project, and a newcomer in Erasmus Plus project and Erasmus Plus team is the next speaker, Dr. Bogdan Pop from the Department of Emergency Situations from Ministry of Internal Affairs in Romania, in Bucharest. So it's an honor for us to host a newcomer, a new institution that will be very important for our topics, like in telemedicine, for the experience, the many years of experience of the Department of Emergency Situations. So I would like to give immediately the floor to Dr. Bogdan Pop for your intervention. Please.
Thank you very much. Also for me, it's an honor to be here, part of this consortium. I will try to share my screen. I hope I will have no problem in doing that. Just one moment. Can you hear? Can you see the presentation? Yes. Perfect. I will just
full screen. Okay. Perfect.
Perfectly. Yes, please.
Before Dr. Bogdan starts his presentation, can I suggest to everybody to switch off the microphones? Control your microphones, please, and switch off them.
Yes, we are hearing some voices on the background.
That's fine. Grazie, Professor. This presentation is meant for you to see and to better understand our experience, and also what we have in common with telemedicine. The Department for Emergency Situations in Romania is an entity in the Ministry of Internal Affairs, and it coordinates the General Inspectorate for Emergency Situations, the General Inspectorate for Aviation, all the hospital emergency departments, the ERs, all the public ambulances, and the mountain rescue services. So basically, everything that is an emergency is coordinated by us. We have in Romania two types of public ambulances. The public ambulance services, which they are also known as white ambulances. I will show some pictures in the following slides. And red ambulances, which are the same structure as SAMU in France. So we have in an ambulance an emergency physician from the ER, an emergency nurse from the ER, and two paramedics from which are also firefighters. So we have here some of the ambulances that we are using. There are also some newer ones just purchased on European funds. The ambulances, the white one, are the public service ambulances, one in each county, one service in each county, and the red ones are smooth. Also, we have specialized CBRN teams and a lot of personal and multiple victims transport truck, which can transport up to 4 patients on stretchers, 2 intubated and 2 not intubated, or 12 sitting patients. Also, we have national level several advanced medical posts, which are those trucks which are turning into an field ER under 15 minutes from truck to tents, and they can treat up to 100 patients per day. Also, medical evacuation, we are coordinating the medical evacuation at national level. So the Department for Emergency Situations, to better understand our structure, has under it 3 directorates. 1 general directorate for medical emergencies, 1 directorate for decision support, and 1 general directorate for civil protection. Our directorate, where I'm also a deputy general director, has 4 branches. The coordination, the monitoring and coordination branch, in which it is a department of for telemedicine coordination at the national level. EMT and MP, AMP, Advanced Medical Post Coordination. The 2nd branch is Control and Inspection. The 3rd is Training. And the 4th, Analysis and Strategic Development. I will not stress so much on history, but me and my colleagues, we found this picture. It is a very nice picture. The beginning of telemedicine, maybe. It was very nice to show you. Of course, telemedicine, it's an innovative way of providing medical information, and it is very useful in improving the doctor-patient communication relationship. There are a lot of examples of telemedicine also used in Romania. We have the video consultations. We have on the ambulances which are not having in the crew a doctor. So basically the ambulances with nurses and the ambulances with paramedics. Also the capability of video transmission and data transmission. I will get back to that also later on. Of course, audio, text, images, the complete medical file that can be sent through telemedicine. We believe that the telemedicine has a bright future ahead because it also proved its importance, and also we think that it was the next necessary step in providing the standard of medical care to any patients in Romania. In Romania, we are using several types of defibrillators which can transmit the critical data to the emergency doctor in the receiving center. Basically, we're having Corpus 3, which is well known also in Europe, and so on. We have in Romania two types of telemedicine, the inter-hospital one and the pre-hospital one. So I've already mentioned the pre-hospital one. So a lot of lives were saved in pre-hospital thanks to telemedicine. There are a lot of examples in which a trained nurse or trained paramedic managed to save the life of a patient who was way over the injuries or the medical condition of the patient was way much over the first responder training. But thanks to the telemedicine, it was able, with the help and coordination from the emergency doctor in the hospital, in the coordinator hospital, to save the life of the patient. We, as you can see in the map, we have three major coordination centers in Romania. Every county hospital, we have 40 counties and the Bucharest region. Each county is connected to a center. We have the center in Târgu Mureș, which is in the middle, in the heart of Romania, the same beautiful city that gave us the University of Medicine, which is also a partner in this project, and Professor Boeri will soon join us for a presentation. The eastern center in Iași County, near the border with Moldova, for that region, and the Bucharest center. Of course, the hospital telemedicine system is a very important part of the telemedicine, because mainly it helps the less experienced doctors in the smaller hospitals in Romania to receive guidance from a highly experienced doctor in these three cities, in Mureș, Iași, and Bucharest, in order to save lives. I wouldn't go into very much details about the system. We can discuss about this later during the project, or if it is of any interest from the partners. We have as an infrastructure the Dome video call camera, video conferencing monitor, data transmission, and so on. The whole system is operated by a state intelligence service. Is not like CIA or NSA. It's a specialized intelligence service that manages all the communication, all the state communication in Romania. Also, the radio transmissions and so on are managed by this intelligence service. I want to give an example of very used and very important telemedicine data, which is used in Romania. The STEMI protocol, the patients with acute coronary syndrome with ST segment elevation, saved and is saving and will save a lot of lives all over the country, because usually at this type of patients is sent, because of the lack of doctors, a pre-hospital ambulance with without a doctor, so all a paramedic, all a nurse, and they are transmitting the EKG to the hospital. And when they have the confirmation that it's acute coronary syndrome, they will know what to do, and the patient it will be saved. As I already mentioned, the pre-hospital first aid teams are operating also not only the data transmission from the defibrillator, but also with video cameras, in order for the physician, the emergency physician in the hospital, to better understand the pathology of the patient. We used last year, just for an example, in different pathologies, cardiological pathology, trauma, neurological, toxicology, gastroenterology, different types of comas, and other pathologies. The telemedicine was imagined, the multidisciplinary distance consultation used in the health units in the shortest time. So everything is used, and telemedicine is a very useful tool in the benefit of the patient. As also already mentioned before, and you all know very well, it takes sometimes only a few minutes to make the difference between life and death, and telemedicine is helping the first responders into shortening the time between getting to the patient and having a certain diagnosis. There are a lot of benefits, in our opinion, for the doctors using telemedicine. They can cover more patients. They can reduce overhead expenses. There are no geographical boundaries, and of course they can help patients in remote areas. All these principles, they can be used very much also in primary care. So I was telling you a lot about emergency medicine because this is our field of expertise. But as we discussed with our colleagues from UniUPO before applying to this project, I think that our experience can be used to achieve also very well the project results. Of course, there are also a lot of advantages from the patient point of view in the case of primary care telemedicine. Comfort, economy, privacy. You don't have to bring the small children or your grandparents to the doctor. The doctor is consulting you through telemedicine. Another issue that it was for the last 2 years is the pandemic. It was a problem because a lot of our ambulances, for example, they were not used so much only to emergencies, but to general emergencies, but to emergencies caused by COVID-19. Still, telemedicine has remained a desirable method for conducting a consultation where the physical presence of the patient in the office was not absolutely necessary. In the end of my presentation, I will just like to give you the names of my colleagues, that we are the team, the BeEmTel DSU team. All of them were online yesterday. You saw Dr. Alin Popa. All of them are emergency doctors with a lot of experience in hospital and pre-hospital. Daniel is a trained paramedic and is also a first aid instructor. And Mirela is part of our team in DSU, responsible for the management of the project. The tasks and roles of DSU, we are taking this very seriously, and we are willing to fully support the leader, of course, but also all the result-leading organizations, because as it was very well said yesterday and today, there are 5 project results in which our experience, expertise, and know-how can help and push forward the project. I am sure that there are no questions, but if there are any questions, I am available for you, even now or later, or through email or over the phone and so on. Thank you very much.
Thanks.
Mille grazie.
Many thanks.
I will try to
Many thanks,
answer.
Dr. Pop.
Thank you.
For your interesting presentation. I would like to underline the fact that the BeEmTel partnership, the strategic partnership of our Erasmus project, is composed by 7 partners, and your institution and Istituto Superiore di Sanità, the Italian National Center of Telemedicine, are not academic institutions, and this is very important. And from your presentation, I think I hope that we can understand that it's an important and enrichment element that also non-academic institutions can cooperate together. And this combination between experiences on the field, with local and healthcare systems is important and essential for our approach. So the combination of these different points of view. But let's remain now in Romania virtually, but back to university institutions. I would like to give the floor to Professor Cristian Boeriu from University of Medicine, Pharmacy, Science and Technology, George Emil Palad in Targa Mureș, Professor of Emergency Medicine. Please, Cristian.
Thank you very much, Emiliano. So I succeeded to get back home from Cluj. I just drove Mark Lazarovic to the airport. He's actually just sent me an email and a WhatsApp message that he arrived home quite well. I will try to share my screen, but before starting my my presentation, I will just try to give you some words to share with you some of my experiences, my previous experiences with some of our partners in this fantastic project. So you see, Bogdan gave you a lot of information that is basically common as for us as university and the emergency medical structure in Romania. They are linked together because all the design of all our research, of our projects, of our exercises, simulations, didactic materials, e-learning things that we've done, everything was done in common. It was, we were partners, and I mean, as institutions, and of course, as private persons, also with all the teams that that Bogdan mentioned from DSU and what we have in our university, but also in the Mureș County Emergency Department, in the emergency hospital of Târgu Mureș, because as Bogdan mentioned previously, basically emergency medicine in Romania, the modern emergency medicine in Romania was like born, let's say, in Târgu Mureș, starting with 1990 September, when Dr. Arafat had his first emergency call in Târgu Mureș as a very young anesthesia and intensive care resident in Târgu Mureș. And then, of course, the history is very nice. Everything developed very nicely. And of course, starting with 2000, the partnership with the University of Medicine and Pharmacy, the previous name of our academic institution, was continuous. And there were a lot of projects that were done together, that were developed, and they went up to the end with all of them. But the nice thing that I really want to mention here is that it's not only the Ministry of Interior from Bucharest or the DSU or the fire departments in Romania were partners with our university, but also UPO, because I had the honor to meet Professor de la Corte long time ago, and that was actually 22 years ago, when we paid the first visit to the hospital in Novara. And we met Professor de la Corte through a Leonardo da Vinci project that we were involved in. And actually through that project, we built the grandfather of the 3D XVR simulation program software that today is used for training in the civil part of NATO, but also in the military part of it. that DSU is using for a lot of exercises all over Europe, you know, and also Professor Della Corte is using for his EMDM that he's actually running since I think 15 years already. So you see, the connections are kind of old and nice. And I was really very happy when I was asked by Bogdan if I would like to get involved in this project through the university. And also Mark Lazarovic was also like, would you like to get involved? I said, of course I would like to get involved, no problem. So thank you very much for this opportunity, first of all. So these being said, I'm going to present the University of Medicine, Pharmacy, Sciences and Technology, George Emil Palade from Târgu Mureș, which is a very old academic institution. But first, let me show you where we are. So, of course, we are in Romania, and you have some, you know, pictures from our nice places here. And in Romania, that means in the middle of Romania, which is a region called Transylvania. Of course, I should have put Dracula here, but I prefer to put only his castle in the middle of the image. And then it's Târgu Mureș, which is one of the nicest cities in Transylvania, let's say. And here you see Europe and on the map, and Romania, and the red spot there, the point, which is basically the county of Mureș, and in the middle of the county, it's my hometown where the university is placed. Now, it's an old university, as I said. You see, was founded in 1945. Previously, it was a military school, a cavalry military school, actually. And you see at the right side, the left side of the slide, you see the picture, an old picture of the University of Medicine. And below, you see the picture of another building, which is the previous technical and scientific university. There were two universities in Târgu Mureș, which actually joined together, and they founded the new George Emil Palade University of Medicine, Pharmacy, Sciences and Technology, which is kind of new because we started with this new administrative structure like 3 years ago. Of course, there are a lot of advantages because the number of students increased a lot, because it's much more, let's say, the specialties, you know, are much more diverse. And of course, the possibilities to access different types of projects and financing is really much more richer than it used to be. And you have now there a picture of our university. Now, we have around 11,000 students, and we have 6 faculties, including the one of medicine. 35 bachelor programs and 33 master programs running in the university, 7 PhD fields and 2 doctoral schools, a lot of PhD supervisors, and you see more than 300 students, PhD students. We have a lot of foreign students, most of them being involved in the medical studies, of course, from 50 countries, and more than 700 academic staff. And as you can see, the international activity of our university, it's quite rich, as we have 154, so more than 150 bilateral Erasmus agreements. So we have a lot of Erasmus students coming from many countries that they study in our university, but also we are sending our students, and they all have extremely interesting experiences in the countries where we have agreements with, including Italy. I mean, there are a lot of Târgu Mureș students that they study in Bari, they study in Lecce, if I remember well, and in Milan. So really the international activity of our university is quite rich. Now, as you can see, we have not only medicine, but we also have military medicine, we have nursing, we have small specialties, let's say, like nutrition and dietetics and balneophysiotherapy physiotherapy and rehabilitation, physical education and sports. We have master programs, and I'm not going to read them from the screen because you can see them there, and all the specialties that we are running through our masters. Then, one second, something happened with my screen. Just 1 second, please. I'm sorry for that. Okay. This is the faculty of dentistry. So it's not, as I said, it's not only medicine or general medicine, but it's also dentistry. And we have bachelor programs that you can see also on the screen. Dentistry being, of course, the Romanian, Hungarian, and English program being the most important. But also we have the dental technicians and 2 master programs in the faculty of dentistry. Then we have the faculty of pharmacy. And what you see here, it's a picture of the new building. So the campus, the university campus in Târgu Mureș developed a lot especially in the last like 8 years. And there are a lot of
Excuse me, Professor Boerio, we have lost the sharing. Opa. So we are seeing your face, but not the sharing. Your screen.
Let me try again. Sorry.
We saw perfectly before.
How is it now?
Now, okay,
yes.
Okay.
It works?
Okay, yes.
Yes, it works.
Perfect, thank you very much. Sorry for that. I didn't realize that I'm lost in space with this. Well,
don't bother.
I'm coming from virtual reality, you know, so that's why. Okay, so yeah, this is the last picture that I had on the screen is the faculty of pharmacy. And I said that our campus, university campus, developed a lot in the last, especially in the last 8 years, with a lot of investments and a lot of new building and a lot of facilities and infrastructure that really gives all the means needed, you know, to develop nice projects and research together with other institutions in consortiums. Then we have the faculty of engineering. And again, these are all the specialties that are studied in the faculty of engineering, bachelor programs, but also master programs. Then we have the faculty of letters, again with bachelor programs and master programs in the informatics and modern languages and history and political sciences, plus security studies. And the short studies, the master studies that are shown on the screen also. Then we have the faculty of economics and law, also with, as you can see, 7 bachelor programs and like 8 master programs, from public administration going through economics, management and pedagogy, and also the master programs from public procurement going from financial banking and professional master of on European public administration. And another very successful project that was developed in the last years is the branch of our faculty in medicine opened in Germany, in Hamburg. So basically we are not teaching only in Romania, in Târgu Mureș, but we also have this branch. It's still part of our university. It's only that it's opened in Germany. It's only in English, of course. And for the moment, it's only bachelor studies in medicine. This is what we are doing. We started in 1919 with this. So that was the first year. Now we are in the 3rd year. We have students first, second, and 3rd year in medicine. And as I said, it's really a very successful project. People were kind of pessimistic at the very beginning that this project will not work, but basically it worked very well. And we have a lot of students there. we have faculties that are teaching, going from Romania, but also we have contracts with different hospitals in Germany where students have the chance to go and do practice with German doctors. So it's a very nice joint venture, and there are a lot of research projects going on already with this branch, which, as I said, works very well. And here you can see some pictures from the doctoral school. So we have the doctoral school of medicine and pharmacy and the one of letters, humanities, and applied sciences, with two different, let's say, administrative structures. But because of that, we have a lot of PhD students, and the activity of the two PhD schools, it's really very, very rich. And as I said, being mainly a medical university, of course, it should be linked to some hospitals. And the main hospitals linked to our university is the Emergency County Clinical Hospital of Târgu Mureș. And you have a picture of it right in front of you, hoping that I didn't lose the sharing again. There are almost 1,000 beds in this hospital, out of which 150 are for children, and 123 daycare beds with 12 beds for companions. And then there is another hospital. It's not only this one, another one bigger than the Emergency County Hospital, which is the Mureș County Clinical Hospital with almost 1,200 beds. So in our county, or in Târgu Mureș, if you want, in the city, there are 2,000 beds as like different specialties and different disciplines, covering basically all the specialties, all the possible medical specialties that we have. And another structure, which is our pride, let's say again, it's the Institute or Emergency Institute for Cardiovascular and Transplant Diseases, which is a separate administrative structure. Geographically, let's say it's placed in the main building of the Emergency County Clinical Hospital, but it's the only place in Romania where children, babies under 10 kilograms are operated in emergency. So if they got born with some, let's say, congenital diseases, heart diseases, they can be operated. So they do surgery immediately to them. And there is also the unique hospital for the moment in Romania where we do cardiac transplants. So this is basically the medical activity that is going on in our city, being linked directly to the university. As I said, we have a lot of bilateral Erasmus agreements, and these are students coming from all over the world, let's say. You see a lot of students coming and going, and teachers, not only students, going and coming, and all of them, they have great experiences here. And our students also, when they come back, they are extremely happy and pleased with the experience they had in the universities that we had agreements with. And actually, I may say that one of the students that had the chance to benefit out of these Erasmus students, it's my daughter, who went to Spain, to Turkey, to Ecuador, and she spent like months there during summer vacation there. It was a study vacation, of course, and she was extremely pleased with these experiences. A lot of international students, as I said, we have hundreds of students. We started with a low number of foreign students. Now it's growing a lot, and we have more than 1,000 foreign students from all over Europe, or I may say all over the world, because they're coming from other continents and they're studying here medicine. So it's, for the moment, it's only medicine, but starting with the next academic year, we will also have a new branch of architecture. 6 years, a bachelor studies for architecture, and it will be only in English. of course, open for Romanian students that they speak English very well, but most of the students that it's addressing this possibility are foreign students. Research center, which is in the campus of our university. Again, this was built, it was a project of 8 million euro that was created through a European funded project, and it has a very, very rich activity. Simulation practical abilities, a simulation center in the university. Students, they have the chance to learn on mannequins and to simulate different situations, not only emergency medicine, but also other specialties. And this simulation center is also linked to the main simulation center that is in the hospital and that belongs to the emergency department. So it's SMURT that Bogdan mentioned already and explained you what does it mean. And actually that is the place where most of the exercises I mentioned using the XVR program, the 3D program, the NATO exercises and many other training programs are taking place. So it's basically a joint venture, again, nice one between the university and the hospital and the Ministry of Interior. And then nice places, nice things in our campus, a botanical garden, a very nice library for the students, sports facilities for the faculty and the students, online shop, editing house, printing center. So basically all the needed infrastructure, you know, to sustain a real academic activity. We have it in our university. And also a local television that is set up in the university, very professional actually, which can be used also in dissemination of our project. And for sure it will be used because all the students, they have access to this television, and of course the faculty in our university. So this is a tool that it will be very useful for us. Smart university, it's digitalized. So we are working on it. The university is like more than 50% digitalized, and we are going up to 100% in the next 3-4 years, let's say. And there are nice projects going on, and I'm sure that we will succeed to do it soon. And now I prepared, but I was sure that Bogdan will give you an idea about the telemedicine system that is in place in Romania. So as I said, the university is very linked to DSU and the emergency system. So basically, this is what we are doing together. So the telemedicine, the in-hospital and the pre-hospital telemedicine works together with the doctors that are also faculty in the university, meaning Târgu Mureș, but not also only Târgu Mureș, because there are, let's say, 5 more classical medical schools in Romania, all of them being involved in this telemedicine, national telemedicine system that links the medical centers together. So Bogdan mentioned that there are 3 important nuts of telemedicine, and this is a picture of our center in Târgu Mureș, where you can get connected in the same time with 4 hospitals, so simultaneously with 4 hospitals that they need help. And you can see there pictures from the resus rooms, in resuscitation rooms in the emergency departments from 2 different hospitals here. This is what the control and command console that we are using in the center. This is a closer image from a resuscitation room in one of the hospitals in Bistrița, and the patient in another hospital. So basically, we can see the patients, we can talk to our doctors there, we can talk to the patients if it's needed, we can examine them. And this is basically the in-hospital system and this is a patient with all the vital functions and everything displayed on the screen. So what they see in their hospitals, we can see in our center. And, and everything, of course, is recorded in such a server. And then it's the pre-hospital system using Corpus and Solid defibrillators that Bogdan mentioned. This is a screen that we have in our dispatch that basically it's the control and command center for the telemedicine, pre-hospital telemedicine system. And this is what we receive in the control center. I mean, the vital signs of the patient, EKG, and so on. And of course, we are in a direct connection with the teams being involved in the rescue of the patients that their data are sent to us. So basically, in terms of telemedicine, this is what we do. And last two words, it's about what we developed in time in terms of distance learning. So we had several projects funded by the European Union, different branches, most of them being the projects for development of human resources. And that there are international projects that we've done together, of course, focused on disaster and emergency medicine. So the topics were that. What is important, and this is the screen, let's say, of one of the projects and the e-learning programs that we created together, the university and the Ministry of Interior, with all the lectures displayed there on emergency medicine. This is a picture of one of the lessons. You know, we developed it with a IT company in Bucharest, which is used also today as partner. But what is important is to mention is that we have more than 2,000 people that were trained already through these the distance learning programs. Again, international programs, international projects. One of it's important because UPO was involved in it, in the development of it, together with the French Society of Emergency and Disaster Medicine. And we use it now. We are prepared to use it because we are building now a master, a local national master in disaster medicine, and we are going to use these materials. So in terms of telemedicine and e-learning, this is what we do. This is what our university is doing. Of course, in the BeEmTel, you've already mentioned it like twice or three times, Emiliano, so I'm not going to put another slide here with our role, because actually we are involved in 4 out of 5 parts, let's say, of the project. And of course, the main thing is to sustain the leading organizations in each part of it. But of course, the e-course design and the implementation is the most important, I think, part of what we have to do. Of course, with all the small activities that are linked to the big thing, you know that. And of course, we are here and happy to go on and to have a very nice and successful project together. Yesterday, you saw that we are working with our partners in other projects too. So yeah. Mark was there with me and my colleagues in the university for another project on virtual reality using the HoloLens 2, and some applications that we purchased as university through another European project. But we are implementing it together with Mark, and Mark is one of our visiting professors in our university. So the collaboration with Munich, with Monaco, with Mark is larger than you can imagine and older than this project, let's say. So it's really nice to have all these nice people together in this project. So thank you very much, and good luck to all of us, and peace.
Yes, it's important. Thanks really for your fantastic, amazing presentation about congratulations for your academic institution. We look forward to visiting your university next year, because immediately
looking forward to have you here, all of you,
this summer. Yes, we will have the transnational meeting next year. in spring, but in this summer, on June 2022, we'll go to our Greek colleague in Thessaly. So you know that European Commission prepare an evaluation format for the entire project. So the European Commission sent, as usual, this evaluation, and we received the congratulation for the high quality of our strategic partnership. So they discover, they see the deep connection between our institutions, Professor Mark Lazzarovici with you, the institutions, DSU with your university, with Ludwig Maximilian University, and UPO also. So we are interconnecting, and this is a very positive element for the development of our project. So now I propose to you a coffee break, so we can see in 10 minutes at 4 o'clock. We will discuss about an important, very important group of our BeEmTel project, the Quality Committee, directed and coordinated by Dottoressa Michela Barisone. She's here. She's the soul with me of this group, of this project, the entire project. We will work together. So we are very glad to host her talk. But first of all, our coffee break. So thank you to the audience, and let's see in 10 minutes. Welcome to our kickoff. The last sessions of today is devoting to the analysis of and the presentation of the Quality Committee activities in our BeEmTel working groups. The coordinator of the Quality Committee is Dr. Michela Barisone. So I'm happy to give the floor to her. So please, Michela, you can start.
Okay, thank you, Emiliano, and thank you all. It's a real pleasure to be here with you. Before we start, please allow me to thank the project manager, Dr. Emiliano Loria, and all the coordinator group of the University of the Eastern Piedmont for their precious work for this organizing this kickoff. I share my screen. I share my screen. Sorry. Okay. Moment, sorry.
Okay. You see?
Okay. Okay. Thank you. The main objective of the Quality Committee is to ensure that the BeEmTel project provides a quality experience and that the expected results are coherent and consistent with the project plan. It's a very, very important to focus on the monitoring of this project. One of the priority activities of the quality management concern the responsibility. The beneficiary organization, for example, the partner, will be responsible for the results and quality of the activities implemented, regardless of the involvement of the other organization or individuals. This is to emphasize that each partner institution has responsibility for the activities assigned to them. Now let's use briefly see what the task of the Quality Committee members are attend meeting, All members of their delegate representatives will attend all meetings. It is therefore important to participate in planned activities. The quality committee group has to monitor the progress, monitoring the progress of the activities and adherence to the deadline for each phase of the project, in line with the project timetable, and assess any discrepancy. Prepare the update and follow-up of the project phases, monitoring and evaluating project activities through the qualitative and quantitative indicators set out in the program. A very technical matrix of qualitative and quantitative project indicators has been formulated. Communicated and discrepancies to partner organization in a timely manner. This is an important step, it is a very focused step in order to correct any deviation of the way. This chart represents the key concept on which the quality committee activity focuses. Monitoring will be carried out taking into account Erasmus Plus standard, reference guidelines, standard model, standard template, through face-to-face feedback, evaluation form, and internal evaluation reports. I mentioned it above in order to guarantee the assurance standards of BeEmTel metrics has been created. Each phase BeEmTel project will be monitored and evaluated through qualitative and quantitative indicators. And it with great pleasure that I introduce you to the members of the quality committee group. I will be coordinating the quality committee group together with Dr. Matteo Fogno and Dr. Anna Rapa from the research office of the University of Eastern Piedmont. With you will be Professor Evangelos Pradelos and Dr. Areti Xatsi from the University of Thessaly in Greece, Dr. Alin Popa from the Romanian Ministry of the Internal, Dr. Selina Kim from the Ludwig Maximilian University of Munich, Dr. Anna Maria Hosniak from the University of Zagreb, and Dr. Carmen Germa from the University of Târgu Mureș, Romania. I apologize, I have not pronounced some name correctly. Thank you. As you can see, let's use now look at some example of evaluation and monitoring on some processes of the BeEmTel project. Let's start with project management. It will be very important for the quality committee activities to evaluate and monitor the project management activities over time. The main objective will be to verification that project schedule management activities are performing via a documented process. How? By monitoring the activities in the project schedule management plan. How many meetings are held, minutes of meeting agenda, meeting participant list, and signature. It's a very important input to include in the monitoring. Then the quality committee team will look at the activities and their evidence. It's very, very important follow the evidence in the activity of the project management and in other topics. Another example of monitoring concerns international mobility, European mobility. It will be important to check the activities and documents produced concerning international mobility. This monitoring activity also include checking how the student selection procedure is a very highlight this point. We are implemented in the organization involved the feedback from the participants, template model regarding the application procedure, international strategy, internal core for application of the organization partner. It's very important. Another example of monitoring related to the dissemination and exploitation. It will be important for the quality committee to check and monitor the dissemination activities of the BeEmTel project. How? By visiting dissemination communicator channel. It's important to follow social media, website, and input for the learner, the participant, and reporting of the dissemination events. The input included the dissemination plan, website, dissemination material, dissemination event reports, final conference program and report, a trained learner program and report. It's the input to include in this monitoring. The quality committee will produce internal reports following standard templates guidelines for reporting of steering committee meetings, internal evaluation feedback form, level of satisfaction, challenges spaces, recommendation for improvement, and travel reports, for example, is very important. And also financial reporting form, timesheet, staff statement, officer form, and work stage reports. And for the financial, this will be an important and dedicated aspect that needs to be monitoring very careful, and is important precisely by the quality committee member. Work stage reports and ongoing review of progress and feedback for partners will also be included. I'm sorry for the picture is not, the imaging is not very good, but this is just to make you understand that each phases of the BeEmTel project will be monitored and evaluated with the specific indicators such as quantitative and quality and quantitative indicators. A data set of indicators with monitoring frequency has been declined for each project phases and activities. Finally, the impact of the project will also be monitored, and what action will be taken in the short term, medium term, and long term to ensure maximum dissemination. These aspects we also be monitoring and evaluating. For example, for short-term impact activities, the monitoring concerns the scientific paper produced in Peer 1 will be published in impacted international journals, for example, or presented the delivery the Peer 1 at the European Congress of the University Education, for example. This is some example for the monitoring impact in long term. What will be the next step? The first quality committee meeting will take place soon, probably by the first half of April 2022. At this meeting, the monitoring plan and the complete metrics of monitoring action with the qualitative and quantitative indicator will be presented of the staff of the quality committee group. Thank you for your attention, and I'm available for any question. I'm very happy to discuss with you. Thank you very much. I leave the floor to Emiliano.
Thank you, Michela, for your presentation and your activities. It's very important to underline the future and eventual critical points of the project, of the development of our activities. There will be, and there are many activities, you know, and tomorrow in the last session of our kickoff, we're going to have a really important occasion to talk about budgeting rules, transnational project meetings. So maybe further details we can provide tomorrow. And about tomorrow, I would like to mention the interview and the talks after the greetings by the scientific director of BeEmTel, Professor Aimaretti. We have the talk by Francesco Della Corte, our professor, the director of Simnova. He will talk about the new challenges for simulation. And then we have Professor Mark Lazzarovici, the director of the Human Simulation Center. Also, he's the president of SESAM, one of the most important European association society about simulation and its application in health study. And then the presentation of our Croatian partner, the University of Applied Health Science. We will have Professoressa Snježana Čukljak, and I thank from now he also to be here. And so we will talk also about the tutoring group and the recruitment criteria for the selection of our 215 participants, future participants. I remember that our project is for undergraduate students or better graduating students, so near to the end of the first level of the higher education path, so not for PhD, unfortunately. This is a limitation imposed by the rules of enrollment in the Erasmus Plus project. So maybe the future forms of our project will include also PhD students. I say this because after the kickoff after the yesterday appointment, we received some emails and clarification about this point. So I repeat, our project, our future e-course will start from the month May of 2023. So we have time, and during this year we have to prepare the contents of our e-modules, and the e-course will last 1 year, almost 1 year, until the spring 2024. But it is dedicated and devoted specifically to graduating students from several disciplines, nursing, of course, medicine, of course, and also psychology, psychiatry, and we also biological engineer. So if there is any other clarification from you, from the audience, please, we are here for you.
Sorry, I have a question for Dr. Bogdan Pop. It's possible?
Si mi dica, please.
No. Hi, Bogdan. First of all, congratulations for your great presentation. It's very, very interesting. I want to ask how the training for the use of the telemonitoring for experienced telemonitoring nurses take place in the community. Does the training take place in the multidisciplinary teams or for each professional? The individual training for nurses, specific training for nurses, or technician?
Thank you very much for this question. So as I was telling you, telemedicine in Romania, or the part of telemedicine, which is the biggest part that we are coordinating, is only in the emergency sector. So it was, I think, a few years ago, and please, my colleagues, if I'm wrong, just correct me. A few years ago, it was a project of Ministries of Health order to implement telemedicine also in the rural areas for the JPs, for the general practitioner. So right now in Romania is working only the emergency telemedicine. So this is my first point. Second, also a very good point from your side, and thank you for the question, is the training of the nurses and paramedics is done in our centers. We have training centers all over Romania. We have training centers in for nurses in the ambulance services, and for paramedics in the emergency inspectorates all over the country. We have one county emergency stations inspectorate in each county. So this is usually where the training is done, but also in how do you say it, in their working place also. So for example, the paramedics are trained in the ER. I can get into more details if needed, maybe in another session, maybe in a workshop. I don't know. It's we can discuss about this, how the training, and we can do a presentation of this with Professor Boiriu. As he said correctly, us as a state agency and them as a university, we are working together very, very much. What he didn't mention, that one of the guys, the young doctors with Dr. Arafat back in the 90s, it was him. So, this is also very important, and he has a lot of stories to share with us. But what is important to know that the training is done also on daily basis if needed in the ER. So in the ER, the emergency room or emergency department or of a county hospital, a county emergency hospital, has the responsibility for all the pre-hospital smooth ambulances. From the medical part. So as I've told you in the beginning of my presentation, the smooth ambulances are consisting of physicians and nurses from the ER and paramedics, but all of them are, let's say so, methodologically coordinated and operationally coordinated by the ER. I hope this at least partially answered your question. Thank you very much.
Thank you, Dr. Bogdan Pop. Congratulations. I think it's very important to raise awareness, the community of the monitoring opportunity. It's congratulations for your activity. Thank you. Thank you.
If there aren't any other questions or concerns, if the directors agree, we can close these sessions. And
thank you to all, because Also today we are learned new important things on telecare and telemedicine, and this is very, very important. I think that at the end, the communication and the cooperation between all of us would be very, very important for the future of the health, for the future of the research in this field. So I'm very happy. Thank you so much. Thank you so much, and see you tomorrow at 2 o'clock for the last day of our kickoff meeting. Thank you. Thank you. Bye-bye.
Thanks.
Bye.
Ciao. Ciao.
Thank you all. Bye-bye.
Bye-bye.